So I'm gonna just go through the lab quiz material just to kind of talk about it real quick. We're just gonna start with skin, which of course what we know, the superficial layer. Below that, we'll have a subcutaneous connective tissue. You can kind of see here. What could be confusing is aponeurosis for some people, but a good indication is this white spot, and aponeurosis connects the two bellies from the frontalis and occipitalis. And then let's go to muscles of the face here. Going back to this aponeurosis, we have the occipital frontalis, which goes from the anterior to posterior aspect. There's the belly there. Orbicularis oculi encircles the eye. You have the nasalis, which goes kind of like a vertical or horizontal from the nose. We got zygomaticus major and minor here that draws the side of the angle of the lips to the, as if you were smiling. Orbicularis oculi. Then we got mentalis, which I want to say could be this one. I wonder if there's a better. I think this is also missing it. But it's like right on the chin. You just want to make sure you don't get confused that there's also like two or so other muscles here. One is the depressor labii inferioris, which would be this guy here. Think labii for lips. There's another muscle like the depressor anguli inferioris, which goes to the angle of the lips. The anguli we don't need to know for this quiz. We're gonna go to medial and lateral pterygoid, which might not be the best on these models here, but let's see, this one. The medial pterygoid could be actually this guy down here. It's gonna attach from the pterygoid plate of the sphenoid bone, and it then goes to like this like inner aspect of the mandible, whereas the lateral will go to the side, and then it will attach more so to like this area. I don't remember the attachment point. But those will be the muscles of the face here. So trigeminal nerve, I'll go back over here. Trigeminal nerve is this big guy, comes out of the ovale spinosum rotundum, innervates the face. You have also the facial nerve. The facial nerve is this guy, comes out like the stylomastoid foramen, and it comes here. Then we also need to identify lingual nerve and inferior alveolar nerve. So these branch off of the third division of the trigeminal nerve here. And I just kind of follow my way. I remember that lingual nerve is going to be on top of the inferior alveolar. So this one here, as it kind of looks like it's going to go to the tongue, so we call this the lingual nerve. And this one that's cut off would be the inferior alveolar nerve that goes down here and innervates the teeth. You can kind of see another image here where this more superior nerve would be the lingual, and this bottom one here would go down into the teeth. You can also kind of tell for the inferior alveolar, it will go through a foramen on the internal aspect of the mandible. Now we need to know the inferior alveolar artery. So just look for the inferior alveolar nerve. This 125. It branches off the internal carotid, which then goes into the maxillary. Don't need to know those yet or at all, but looking for this nerve, this artery that goes also into the foramen here will give you an indication. And just kind of following where it's at based on even just the name itself. we're gonna be looking for the superficial temporal artery. So think about superficial on top and temporal bone. And it's gonna be this guy here, just along the side of the scalp. And then a couple more is the supraorbital artery, which you can kind of see it here. It comes out of the supraorbital notch, and it goes kind of, how I kind of follow it is it goes through the inside of the eye, and then it kind of lines the eye and comes that way. But it would be like this guy here, or you look here, the supraorbital notch, and it goes up here. Facial artery, I think this one right here is indicating facial artery. You kind of backtrack where it's coming from, and it should be branching off of the internal carotid. Now, temporal bone, which is cut off here, but it'd be just along this side. Actually, here it is. The temporalis is covering it, but temporal bone here. Mandible, of course. And let's do the tongue. So I think I got a good model over here. So the genioglossus is this big muscle. It's kind of like really what the tongue is derived from. And then the styloglossus, which isn't on this image, but it will maybe hopefully go back, unless, oh yeah, here we go. So styloglossus, glossus is tongue, and stylo for styloid process goes here. And then you're gonna have this other muscle called the hyoglossus that's gonna attach the hyoid to the tongue. But we really don't have a good image here in the lab. I'm trying to see if none of those really show it. So we'll just kind of move on. Tonsils, the palatine tonsil is here. We don't need to know the lingual, but it is good to know. So palatine is where my finger is at. We'll talk about salivary glands. So we have the submandibular and the sublingual, and then we have the parotid here. Now we want to know the cribriform plate. Let's see if we can see it in here. It'd be right there, but let's see if we have a better angle. It's kind of, that's it right there, the crista galli, which you don't need to know the term of, but this is the cribriform plate. It's where the olfactory nerve innervation comes, so you can smell. We're gonna now talk about the nasal part of the frontal bone. So the frontal bone, but it branches down here. We call this the nasal or nasal part of the frontal bone. We got a couple sinuses we need to identify, such as the sphenoid. We got the frontal, and then let me go over here real quick and show you the last two. I think I saw the model over here. So just to recap, frontal, sphenoid, and then we have maxillary, and then ethmoid. All right, we're almost done. So we are going to do the nasal concha. The nasal concha are these guys. They're like the turbinates. When you see if it's boggy or not through your nasal exam, you have the superior, middle, and then inferior concha, or conchae, I think if it's singular. Extraocular muscles of the eye. So if I just had an eye itself, I'll try to orient myself first, because you might be labeled, you might have a muscle labeled that you're not familiar with, the orientation, and that would throw it off for superior, inferior, medial rectus. So I always look for where the oblique muscles are moving towards. So you see how both of them move towards the right. And I know the direction it moves medially. So I know that this will be the medial side, and this will be the lateral side. So we have superior rectus, inferior rectus, and then we have inferior oblique, superior oblique. We have the medial rectus, and then we have the lateral rectus. And then you're gonna have a muscle that lines the top of the eye here, which is where your the eyelid would be. And that muscle is called the levator palpebrae superioris. We really don't have a good model here to show that specific muscle, but it kind of goes in and come kind of from in where my hand is and pulls up. Next part about the eye is the lacrimal gland, which is going to be on the lateral aspect of the eye, like that, like such. Oh, actually, this would be, this is the levator palpebrae superioris right here. And then you have the conjunctiva, which is gonna line the eye and inner eyelid. You don't need to distinguish between bulbar and palpebrae, but the bulbar aspect would be around the eye. This aspect, the sclera, and then the palpebrae would be when you pull down the eye to check if they have jaundice or whatnot. It'd be this aspect. We have the sclera, the white aspect of the eye. We have the cornea, which is going to encompass over the eye right here. You have your pupil, the iris, is the colored part. And that is all we need to know for the eye. Let's move on to ear. You just need to know external ear. Couldn't get easier than that. Talk about the sternocleidomastoid, which is not there, so we'll move over here. The SCM, sternocleidomastoid, attaches in this aspect to the mastoid process. So look for this big muscle that's coming all the way from up here to down here. The trapezius is on the back. Then we need to know the suprahyoid muscles. I wonder if you can see. I'm good on this. Let me not break anything. So a little bit. So the suprahyoid muscles consist of the digastric. Digastric has two bellies, here to here. Okay, let me repeat. From here, and it goes to here, to the mastoid. Just remember that it's this one. But this guy, the stylohyoid, it actually goes from the hyoid to the styloid process, goes straight back. How I remember this is the digastric. The digastric goes through like these two legs of this muscle attachment of the stylohyoid. So it kind of crosses like a V, and it goes under. Goes in between. The digastric goes in between, like where my fingers would be, and that comes out here. Mylohyoid So mylohyoid is going to be the more superficial muscle. It's going to be this big guy here. It's under. And then you can't really see unless you strip it away. So just another view. So the mylohyoid here and under there. This actually is still the mylohyoid. And then a deeper aspect is going to be the geniohyoid. So that is our suprahyoid. And last but not least, we need to know infrahyoid. I think this might be a decent model. Let me just check over here. I think this has part of it. So we have the sternohyoid. So the sternohyoid is a more superficial layer. It's this top one. It's going to attach the sternum, which would lie right here, go straight to the hyoid. And then I orient myself by first finding the superficial layer. Then below that is going to be the sternothyroid. As you can see, it would attach to the sternum, but it doesn't go as far up. And then we have the omohyoid. Omohyoid has two bellies, so it attaches here, and like it tapers and then attaches here on the scapula. And the last but not least that we have, which I'm actually not really seeing it here, would be the thyrohyoid. It's a small muscle that attaches from the thyroid cartilage to the hyoid bone. Let me just check over here. Okay, so this would be the omohyoid, and I want to say this deeper layer is the thyrohyoid. It's just a very small muscle. And after all of that, that is all of the structures, at least on the models that we have here. And then we'll need to know for the cadavers as well.